And just speaking, but sorry, very no sir. Slowly over and over, tapping దగ్గర కూర్చోబెట్టి ఇది అది ఎడిటింగ్ మాత్రం ఇంగ్లీష్ కదా మొత్తం మనకి చేయగలిగితే పర్లేదు యూ కెన్ గివ్ చెక్ నేను చేసే స్పీకింగ్ సారీ Hello and welcome to Seven Sentinels. This is GrandMasterClass and I'm Peter Simon with you.
How may I address you?
You can call me Lincoln because my name is Abraham Lincoln.
Okay, sir. Okay. Good evening.
Good evening, nurse.
My name is Mandeep Kaur. I am one of the registered nurses working here in this locality. I have come here to visit Mr. Lincoln.
Yes, nurse, I am Lincoln. Come on in, have your seat.
Okay, thank you. So, Mr. Lincoln, your doctor has asked me to talk about the self-administration of insulin injections, so that as your blood investigation reports revealed high blood sugar level, so it has become necessary to inject insulin injections right now. So, is that okay with you?
Yes, nurse, definitely. But why the doctor wants to change the treatment plan? I want to know. What is the reason? I'm managing well with my diabetes diet, medication regimen, and the prescribed exercises. Going on smoothly, then why? What is the reason?
Okay, so Mr. Lincoln, your concerns are reasonable, as I appreciate that you are maintaining well with your diet. But however, despite excellent compliance with regular medications, exercise regimen, and diabetes diet, the blood sugar level cannot be managed effectively, and therefore insulin injections have been prescribed. Do you follow me, Mr. Lincoln?
Yes, nurse. Okay. Is there no other way to manage my diabetes, nurse?
Yes, your concerns are reasonable. As I told you that your blood sugar level is not maintaining well with the diet, and your investigation reports shows the elevated blood sugar level, so which could be controlled with the only insulin injection. So this is the only way how to control your insulin blood sugar level. So
Okay,
Do
nurse,
you
if
follow
there
me?
is no other way to manage my diabetes, then okay, tell me what I should do and what is the procedure. Explain me everything.
Okay, so let me tell you about the insulin injection procedure. It is a very it is a very it is not too tough, as the most of the people are injecting the insulin injection on their own. So it is not difficult to inject the insulin injection. So for that you have to use only one insulin vial, and you have to inject through the syringe, which is not be painful for you. So as this is yes.
Okay, nurse. So what am I supposed to do now and how? Tell me in detail, please.
Okay, so for that, I will give you the more information about the procedure. Like for when you have to inject the insulin injection, so the first one you have to do is wash your hands before the procedure, and after that you can use hold while in the upright position, and don't shake the vial to prevent from the bubbles, which will be difficult for you to collect the exact dose as you required. So after that, I will suggest you to prefer the different sites to inject the insulin injections. Like you can use on the forearm, and you can inject on the front of the thighs, and also you can inject it on the belly side. But be sure on when you're injecting on the abdomen, you should be inject from the two fingers after the belly side. So am I clear so far?
Yes, of course, nurse. And should I change the places every now and then, or should I take in the same place?
Yes, that's a good question, Mr. Lincoln. For that, let me tell you that it is better to change the place regularly, because it can prevent from the redness, and it can cause lump if you inject the injection on the same place, so which will be painful for you. So it's better to change the places regularly so that you won't feel any kind of trouble. Am I clear so far?
Okay, yeah, nurse. And okay, what should I do with these used syringes and needles?
Okay, so for that, I will provide you a container. So after each use, you have to discard the syringe in that container, and you have to burn the needles in that container, so that it can prevent for the further harm. And it is mandatory that you don't use the syringes again and again, and you have to discard the syringe after each use. Once the container will be full, you can call me. I will come and replace it with the another one. So is that okay with you?
Yes, nurse, that's fine. But okay, I am not a nurse by profession, or I do not belong to the medical profession, and I have to take all these medications. And if anything goes wrong, and if there are some side effects, then what am I supposed to do?
Okay, all right, Mr. Lincoln. For that, as I told you that the insulin injections don't doesn't cause any kind of harm, as it is just superficial injection which is injected on the in the skin subcutaneous area. So it will not cause any kind of harm, as major of the peoples are using the injections as a safe, and it's a good method, as they are not coming daily to inject the insulin injection in the hospital. So it is very safe procedure for you. As you have any concern, I will be there, and I will teach you. I will come for this week, and I will teach you each and everything, so you won't feel any kind of trouble. Once you know about the procedure, you will be worry less. So for that, it will be okay for you.
Definitely, nurse. I'll follow your suggestions.
Okay, so additionally, I will also provide you a leaflet which contains all the information regarding the administration of insulin injections, and it also depicts the pictures which shows that how to inject the insulin injection. So it will help to learn more about it. So am I clear so far?
Yes, nurse. Absolutely fine.
Okay,
Right.
Mr. Lincoln, do you have any more concern which I
No,
can clear
nurse.
for
That
you?
is very clear. You have explained everything to me. Thank you very much, nurse. I
Okay, thank you.
appreciate your concern.
Yes, thank you, Mr. Lincoln, for your cooperation and listening to me patiently. I assure you that if you follow all the instructions, you may definitely lead to a healthy life.
Okay. Now let
Okay, thank you.
me tell you, I'm going to give you the feedback now.
Yes,
You
sir.
have taken 8 minutes.
Okay,
So time management is a problem. Time management. You have taken 8 minutes.
okay, sir.
Okay. So you have to finish in 5 minutes. Okay.
Okay, sir.
Right?
Yes, sir.
So, right. And lastly, you're asking, still do you have any concerns? If I say 2 more concerns, again you will take another 2 minutes, right?
Okay, sir.
So, close it. You can
Okay,
just say,
sir.
I believe that I have given all the clarification which you require. But in
Okay,
case
sir.
in the future, if you have any concerns, you can always contact me. Like that you can tell. Okay?
Okay, sir.
So you have to close up. No? You have to wind up. You cannot prolong the session for more than 5 minutes.
Okay,
That
sir.
shows that you are not very strong. Okay?
Yes, sir.
Then next one. Thought processing is good. Okay? What do you mean by
Yes, sir.
thought processing? Thought processing means your development of the story and building up of the sentences, and one by one you are building, following up and making everything clear. That processing is excellent. That's good. And
Okay, sir.
fluency is also okay. You are very fluently speaking. There are not too many pauses and breaks, but there are pauses and breaks. But
Yes,
fluency
sir.
still is okay.
Yes,
There
sir.
are pauses and breaks, and you have to manage. Suddenly you get stuck and you stop in between for 1 or 2 seconds. Okay,
Okay, sir.
so
Yes, sir.
that you have to focus a little more.
Yes,
Okay,
sir.
and then next one is unnecessary sounds are there. You have to avoid these unnecessary sounds. Okay, you have
Yes,
to
sir.
avoid these unnecessary sounds. How can we avoid these unnecessary? By practicing more, by practicing regularly. Okay, if you
Okay,
practice
sir.
regularly like this every day, 5-10 minutes. Okay, use
Yes, sir.
practice. How many speaking practice sessions did you do today with the interlocutors?
Sir, 4 sessions.
Very good. Like that every day you have to do. Fine.
Yes, sir.
And then when you come to me, I'll give you corrections. Right.
Okay, sir. Yes,
So
sir.
next one is accuracy. Accuracy means, okay, what is accuracy? Correctness.
Yes, sir.
Grammatically correct. Okay, pronunciation correct. Okay, grammar correct. All these things together is called accuracy. So
Yes,
you have to
sir.
need to work on this because there are many mistakes which you are committing, which you are doing. Okay. So for
Okay, sir.
next one, vocabulary. Vocabulary is also average. You are not using very extraordinary words. Okay. You can use some excellent words. Don't
Yes,
speak like
sir.
an ordinary person. If you speak excellent words, you'll get excellent score in vocabulary. And then
Okay,
grammar.
sir.
Grammar you need to focus again. Okay.
Okay,
Grammar
sir.
you need to focus. And then the another. What do you mean by the another? The means
Okay.
and means the. Okay. The means and means the. So you have to understand that. So no need the other or another. The other means the second one. Another means another one. Okay. Use
Yes,
the
sir.
other or another. The or
Okay.
an, anyone you can use, but you are saying the and another. That's wrong. Okay.
Okay, sir.
Then peoples are using. What do you mean by peoples are using? You can just say people are using, right?
Yes,
You
sir.
can just say people are using. So you are saying peoples are using. People is already
Okay.
plural. Huh?
Yes, sir.
So next one, pronunciation is okay. You can still improve. And time management, that's 8 minutes. Okay, you have to
Okay,
reduce
sir.
that one to 5 minutes. You have to limit to 5 minutes. And then confidence level is high. You
Okay, sir.
whatever you know, Subject knowledge is excellent. You have good subject knowledge, okay?
Yes, sir.
Subject knowledge is excellent. So what is subject knowledge? Subject knowledge regarding your medical terms. What to do regarding insulin. Subject, okay?
Yes, sir.
Excellent command on the subject. That you have wonderful knowledge, wonderful idea. Excellent command on the subject. What is the subject? Insulin injections. That you have. But English,
Okay, sir.
regarding English, that is little. Uh,
Yes, sir.
knowledge you have, but how to express in English is different. No?
Yes, sir.
Yeah. Overall impact is good. Overall impact is good. Fine.
Okay, sir.
So this is the feedback which I have given you. You can
Okay, sir.
practice, okay? You can
Yes,
practice
sir.
well and you can go ahead like this on a daily basis, okay?
Okay, sir.
Right. Okay, dear. Take care. Bye-bye.
Okay. Thank you, sir.
Bye. Bye.